Right, so we have been through this one. Let's go through a chest X-ray to kind of ease up a bit on the cross-sectional imaging, because cross-sectional imaging can be a little bit involved, kind of. All right, so we're looking at this chest X-ray. Okay, looks like it could be normal. We know it's fairly young. Sometimes you can tell that they're fairly young because you don't have calcifications of the more sort of chondral aspects of the interstitial bezoar could be differential too. Bezoar, yeah, I suppose so. You'd have to have a history of someone swallowing a lot of things, but when it's spherical, without the previous case, when it's spherical and you've got that, you can't use that differential because we've got almost a slam dunk diagnosis because you've got air within the biliary tree, air within the within the gallbladder, and that spherical lesion. And so when you balance it, it can't really be anything else. It's not going to be bezoar in that particular situation, not when you've got so many other findings that are kind of pushing you towards gallstonealias. So this one is a youngest patient, and they have got this chest X-ray. They've come in, and they are fairly young because you don't really see much in the way of calcifications in the sort of sternal area. So if we look at this, at first it may look like it's okay, but my check area is always going to be the costophrenic angles. Costophrenic angles look like so. These areas here look very, very sharp. They look fine. Lung apices, they look okay. And a bit of a pro tip would be not to just take it at that value. You want to zoom in and also pan and have a look at that lung apex and make sure there's no sort of pneumothorax and the lung markings going all the way through to the edges, all the way through to the edges. And they all look okay from what I can see. Right, so the lung apices look okay, that's good. And then you want to look under the hemidiaphragms. So look under the hemidiaphragms and make sure there's no air under the hemidiaphragms. Make sure that you can't see any air sort of seeping up here. Sometimes air that goes all the way along like so shouldn't be there. You should have no interface between these structures. And if you do, then you're looking at a continuous diaphragm sign, which we don't see here, which is great. So everything looks okay so far. And then look behind the heart. We don't see any abnormalities, no lesion behind the heart. We don't see any sort of sail sign. Sometimes you get tenting of the diaphragm to tell you that there's been some loss of lung volume sitting within that hemithorax, which we don't see. Sometimes you get elevation of the hilar, but the patient's slightly rotated, so there's not quite equidistance between the two, maybe slightly angled when they took the X-ray, but it doesn't look like there's any particular loss of lung volume. And the distance between the ribs, they all look okay as well. So that's another way to tell whether there's any loss of lung volume. Now, when you look at this, this should be very, very sharply contoured. There shouldn't be any sort of particular soft tissue density here, but someone has quite rightly said that there is what looks like the sort of globular looking appearance sitting over here, and actually you've got your aortic knuckle sitting over here, but you've actually got more soft tissue sitting over here. So what could be causing that? It's going to be adenopathy. So at this point, you can't really say much else. You can't say much else. It could be sarcoidosis. It could be lymphoma. It could be tuberculosis. Now, in this particular occasion, it turned out to be tuberculosis. That was the cause of it, but it could be any of those other things. Now, with sarcoid, you may have sort of reticular, sort of net-like densities that are going along like so, but they'll be very, very nodular, tiny little nodules sitting along there as well. That would tell you that it could be sarcoidosis along with the lymph nodes. You can get calcification around the lymph nodes as well, which will tell you sarcoidosis as well. But if this patient's coming with fever, which is what they came in with, then you are probably looking at something like infection, or it could be lymphoma. Lymphoma can cause that kind of thing as well.